The reason I have one up here is because if you look at the picture of the scapula in the lab manual, there's lots of names and it's kind of hard, like a lot of memorization. But if you look at the scapula the way it is on the body, you don't have to memorize as much because this is the midline, right? So this must be the medial border, yeah? This is the outer side, so this must be the lateral border. This is the bottom, this must be the inferior angle. Yeah, it makes sense. So you don't really have to memorize as much. Here's the spinous process of the scapula. So anything below here, this fossa, this shallow cavity, would be the infra, which means below, infraspinous process, fossa. Anything above the spine, the spinous process, is the supra, infra. So infra below, supra above. And we have these two processes here. Good, Juan, thank you. Thanks for your help. The top one is the acromion. See how flat it is? This is the coracoid in alphabet A before C. So A is on top of C here. The importance of these is, well, it's going to tie the shoulder together. And so we need a place for the ligaments to attach. And that's what that clay is for, if you're wondering. That's for, to represent a ligament. And so the clavicle, which is also called the collarbone, here it has a acromial end. So we have the acromion and the acromial end of the clavicle. So these names kind of start tying together. As long as we're looking at the clavicle, if we have acromial end, we also have the sternal end because it attaches to the sternum. So on a test, you know, you could try memorizing all this, or you can just think that's flat. So is the acromion. So that must be the acromial end. This is blunt, fits with the sternum. So if this is a sternal end, this is a clavicle notch, clavicular notch, because it articulates the clavicle. So you know, you start seeing patterns here. Here's the supra, forgotten this one, suprasternal notch. Can we take a look?
Sternal angle?
No, suprasternal notch, yeah. Right here, suprasternal. Super means above and it's a notch. This whole bone here is called the Manubrium. Then we go to the body, and this is the xiphoid process. So we're doing chest compressions during CPR. We want to keep our hand up high on the Manubrium or the body, because if we slip down to the xiphoid, then we're going to drive that bone right into the, sometimes the lungs. Right, on the humerus, there is a head that's going to articulate real nicely with this glenoid fossa. The glenoid fossa is a depression that kind of houses the head of the humerus. There's an anatomical neck and then a surgical neck. And these are important because when we're young and there's cartilage there. That's a growth plate, and so that's where bones are being elongated. So if there's an injury at these sites, we get pretty concerned because that may interfere with growth of the bone ultimately. Okay, we have this roughened tubercle because we need a place for ligaments to hold this shoulder together. So we have roughened acromion, coracoid, and the tubercle. But we also need a place for the huge muscle, the deltoid, the shoulder muscle here, to come all the way down and grab on this roughened area called the deltoid tuberosity. Okay, so tubercle, kind of the warty bumps for the ligaments, deltoid tuberosity for the deltoid. Here's a condyle. We know what a condyle is, like an articular surface, it's smooth, and that's going to be where the ulna is here. Fortunately, we have a olecranon fossa so that we can straighten our arms. And there's a little, yeah, there it is, a little fossa, a little depression for that. And later we're going to learn the olecranon process, but we're not going to do that today. So if this is a condyle, called the trochlea, up here is called the epicondyle, because epi means above. So if someone has like tennis elbow, there's often a problem with the attachment of the epicondyle here, lateral, or golfer's elbow, medial, because this is the way it is, right? Medial, lateral. There we have it. I think we got it. Thanks.
Quick question.